Good to go, Dave.
Hello, everybody, and welcome to this session of the Safer Births Now virtual conference. My name is David Johnson, and I'll be moderating today's session. It's entitled Modern Tools for Safer Births. The Safer Births Now conference brings together clinicians, researchers, innovators, parents, their loved ones, and advocates from around the world, not just the country, welcome U.S. Virgin Islands, with a shared goal, improving our outcomes for Black mamas and newborns. We're excited to have you join us for the discussion. It is my pleasure today to introduce today's speakers, Dr. Katherine Sylvester and Rachell Dumas. Both have lived experiences and professional expertise that are invaluable in the creation, development, and delivery of practical solutions to support maternal health. They are entrepreneurs, educators, technologists, healthcare professionals, inventors, and survivors. They recognize data is essential in advocacy and care, and they each recognize the need for smart technology to assist patients, advocates, caregivers, and healthcare professionals in maternal health. We'll take each of them, we'll talk for about 10 minutes each regarding data, their solution, and throughout, we welcome questions in the chat, and I will monitor them and ask them on your behalf. So, Dr. Katherine Sylvester and Rachell Dumas, welcome and thank you.
Thank you so much. So excited to be here. If at any point you cannot see my slideshow, please let me know. And then if you have any questions, feel free to interrupt. I'm so excited. So I am Katherine. I'm a physical therapist, been a PT for 16 years, and started working with moms after becoming a mom. Just noticing that moms were having issues, peeing on themselves, having pain with intercourse, losing weight. They had scar tissue that was causing problems. And with my second delivery, I realized that monitoring was being done, but wasn't being done as frequently as it could have been. So I started Operation MIST. MIST is an acronym for Monitor, Intervene, Survive, Thrive, and I started it after my midwife caught my preeclampsia. So I didn't have the risk factors, I guess, that people would traditionally associate with being at risk for preeclampsia. But what ended up happening was toward the end of my pregnancy, she checked my blood pressure. My blood pressure was 128 over 78. And so for a lot of people, they would say, oh, that's a good blood pressure. But for her, she looked at me and said, Katherine, that is not your blood pressure. Let's look into it. And in looking into it, and I was in the early stages of preeclampsia, and because of her investigating my symptoms early, my numbers early, she was able to catch it and we were still able to have a successful birth at home. But after delivery, what I realized was that she asked me, she's like, Katherine, you should really try to go on bed rest because we never know what's going to happen after delivery, especially if your blood pressure started climbing during pregnancy. And so I thought I was backing off of activity. I tried to do what she told me to do, but I really didn't have an objective way of doing it. I had an older child, so going on bed rest really wasn't an option. But I was definitely doing too much because within the first couple of weeks, I ended up in and out of the ER with blood pressure that was through the roof. My kidneys were failing. It was a bad situation. But someone sent me a watch and they said, hey, we're trying to see, can we use wearables to detect COVID? So they sent me a smartwatch. And in wearing the watch, within 2 minutes, I realized that it was going to be a game changer for me. I was going for a walk. Most moms are told, you need to walk for 20 minutes a day. It's good for you. Getting out in the sunshine is good for you and the baby. And after 2 minutes of walking, my heart rate was 160. My watch was telling me I was stressed. And I went back home and checked my blood pressure, and it was in the 160s over 105. And I realized then if I just use data proactively instead of reactively, then maybe I'll have a better outcome. And that's exactly what I did. And within 2 weeks, I was off my blood pressure medication. Within 9 months, my kidneys had healed. And at that time, I sent 40 watches all over the country to teach women how to do the same thing. So we built an app. We have an app so that we can monitor moms and help them make these decisions. But we also teach them how to use their own data. We all have apps if we have smartwatches, right? And even if we don't, we can purchase a thermometer, a pulse oximeter, blood pressure cuff, and we can do the same things that I'm going to talk with you about today. Because in doing that, we've monitored now about 300 moms. We've supported over 700 pregnancies, and in doing this, what I'm going to teach you today, women have had better outcomes. They have had healthier pregnancies, and they recover really, really well because they're able to wake up every day and say, this is what my day will look like, as opposed to letting life tell them what their days are going to look like. So I hope you can see this first screen. So the reason we monitor the specific things that we monitor is because heart rate is able to tell us how efficiently is my heart working. Blood pressure tells us how much effort is my heart putting forward to do its job. And we know the heart's job is to deliver oxygen, deliver nutrients, get rid of toxins, things our bodies don't need or that are harmful for our bodies. And so how much effort is being put forth to do that? Oxygen lets us know how effectively is that being done. If our oxygen levels are too low, then maybe oxygen is not being delivered effectively. I can reach out to my provider. Temperature tells us about the environment in which the body is working. And so if someone has a fever, or even if it's a low grade fever, the body's going to have to work harder to do a lot of what it's doing. And that can help people choose better because we know the immune system, or our body can fight sickness rather better if we're eating well, if we're hydrating well, if we're resting appropriately. So we can affect the environment just by checking our temperature. Sleep lets us know how much energy do we have to do what we need to do for the day. And then stress lets us know how long can our bodies keep up with this, right? How much endurance will I have for the long haul if I continue going through my days like I'm doing today? And so I love this because we know research says that our bodies, inside of our bodies as Black women, as a Black community, we age faster than we look. So like our cells, our organs, they can age faster because of stress. And so we want to be in control of that and control the stress that we can control, because we know stress can be, sometimes there are things that we cannot avoid, but at other times there are things that we can. And so what we try to do with using data is make sure that we're controlling what we can control. And so in general, research will tell you to try to get 7 to 11,000 steps per day, walk at least 5 minutes after each meal. So we're kind of helping our bodies manage our blood sugars, drinking half our body weight in ounces in water, sleeping 7 to 9 hours per night, eliminating unnecessary stress. And then for us, we always say avoid eating fast, frozen, and packaged foods because that's what we see drive people's blood pressure through the roof. But then we also like to say, know the research, but research yourself, because there are times when you do not need to get 7,000 steps in a day, right? There are times when you're not going to be able to sleep that much at night. But if we're watching the trend and we're striving for this, then we know we're making the best decisions that we can for our health long term. And so I'm going to share with you today the MIST method. This is what people do who come on, whether it's for pregnancy monitoring through the MommyMonitor or for our program called 365 Vitals. Those are people who come on because they want to get off of blood pressure medication, or their family has a history of high cholesterol and diabetes, and they want to make good decisions so that they don't run into those things. So those are the two different programs where we support people in using data. But the first thing is to invest in themselves, and they do purchase either a smartwatch or the other three things I talked about: the thermometer, the pulse oximeter, or the and the blood pressure cuff. And so what we do is we say, when you open your eyes, open your app. And when they open their app, they're looking for resting heart rate, their oxygen levels, their sleep, and their stress. And I have a couple pictures coming up so that you know, but I'm just going through the method with you first. Don't assume you're exempt, check your temp. And so they roll over, take their temperature. A lot of women do this so that they can also track their cycles and know when they can get pregnant, when they're out of the woods in terms of getting pregnant, in case they're not on birth control. So we teach them how to use their temperature for that. Once they look at their stress, they let it inform their list. So they're going to either do what's on their list, delay, delete, or delegate. Okay. And so if stress is high, then we have to think about, well, why is my stress high? And then how can I decrease my stress over the course of the day? And for the most part, we either have a written to-do list or we have a to-do list that's in our mind. And then we make sure that we adjust according to what we see. And then after you pee, check your BP. So you would just use the bathroom, because on a full bladder, your blood pressure may be elevated. So we make sure we use the bathroom first. Then we sit calmly, take our blood pressure, see what that is for the day. And if it's higher, then we know, okay, if I was supposed to go out to lunch today, I'm not going to do that. I'm just going to make my lunch and take it to work with me. Or I'm going to make sure I get my water in today and sleep tonight and do the things that we know help lower blood pressure. And then make sure what goes up comes down. For a lot of people who are exercise enthusiasts, it is important that we get our heart rates up. But within 1 minute after stopping your exercise, your heart rate should come down by about 18 beats. And if it doesn't, then you should look at your workout routine and say, okay, what's going on? Because long term, if that's happening, it puts you at risk for having heart disease, any type of heart problem. And you can just talk with a physical therapist like me or talk with your provider and come up with a workout plan that works for the phase of life that you're in. What we find is that during pregnancy, a lot of women, they'll get their heart rates up, but it can't come back down. And it's because they're increasing the intensity of exercise over the course of their pregnancy because they've heard that it's good to exercise. But what this lets us do is see how much is too much. And then we also want to, duplicate what works, eliminate what doesn't. And so that's why we do this every single day. We're looking at our numbers to see, are our choices taking us in the direction that we want to go in, or are they taking us away from that? And so here are a few pictures. So when we open up our app, this is what we're looking at. We're looking at sleep patterns. And so if you look at where the 85 is and that nice picture, you see light blue to dark blue, light blue to dark blue. And then during the second half, you see light blue to dark pink, light blue to dark pink. That's what you're looking for. What that shows us is we're going between light and deep sleep during the first half and light and REM sleep during the second. When we see that pattern, we know that we've had a really good night of sleep. Because sometimes people will say, oh, I'm going to take some melatonin because it'll help me sleep. But if they're looking at their sleep quality and their graph doesn't look this way, then it's possible that they're sleeping longer but not having good quality. What I like about this is that we also will then tell people, look at the days when you had a pattern like this. What did the day before look like? Because typically our sleep is just a reflection of what our day looked like. So did we eat well? How much did we move? How much stress did we have going before we went to bed? And so it helps us to recreate days of good sleep. And then we're also looking at resting heart rate. I have a better picture to share with you here. So that blue line along the bottom is resting heart rate. Resting heart rate is pretty consistent. So if it starts to increase, that may let us know that we might be getting sick or we might be getting pregnant. That's what we've seen with resting heart rate increasing. But when you look at it, you see that Friday average, it says 47. My average for the week is 50. And so it's pretty close. But if you notice that your resting heart rate is about 10 beats higher than what your average is, that actually is equivalent to 1 degree higher in temperature. And so it'll make you, if you're 98.6 typically, then that might mean that you're in the 97s. And that's a low grade fever. So it's really good to, if you notice an increase in your resting heart rate, then check your temperature, or if you're in the habit of it, you've already done it. Then you'll know that you could be trending towards sickness. And that lets you know, hey, let me just stay away from people today. If I was going to the movies tonight, I'm not going to do that, because you don't want to get people sick and you also don't want to expose yourself and get yourself sick. We're also looking at oxygen. And the oxygen levels overnight, we actually just caught sleep apnea in a mom. She was just dipping into the 70s consistently. She went and told her OBGYN. OBGYN looked into it, sent her for a sleep study. They did the sleep study. It turned out that she had really bad sleep apnea, and she's now being fitted for a CPAP. And so just checking oxygen every day and seeing, am I saying between 90 and 100? With pregnancy, they kind of like us at 95% or above. The watches are not perfect, but we know that if someone is always between 90 and 100 and all of a sudden they're between 70 and 80, that's a problem. And so and then also the pulse oximeter is a lot better because, it's right over the finger where everything is white, no matter what your skin color is. And so checking oxygen during the day with the pulse oximeter on is really helpful as well. I know my time is running down, but this is stress, and because I want to pass it over to Rachell, I know you have a million amazing things to share. Stress, I really like the app that we use because orange is very high. Orange lets you know that you're stressed. Blue is like you're resting and relaxing. And so you want to have more blue than orange. That's really the goal. And so if we notice that we have walls of orange, like what you see on here, sometimes that has helped us catch hemorrhage, preeclampsia. It's helped us catch low vitamin levels, anemia, things like that. Whereas when we see blue, that typically lets us know moms are doing well unless they're going into labor, right? So we try to help people get a good balance. This is the example that I share with you where we caught fluid overload. In this mom, she was told that if she had stayed home for even 3 more weeks, she would not have made it. And this is important because when we're at home and we're by ourselves, if we have numbers, we know when to call in before our 6-week appointment or before our 4-week appointment. But when we don't, sometimes we can just attribute how we're feeling to not being well. So for this mom, pre-pregnancy, she took 5,400 steps on average. 1 week before birth, she was down to 2,550. And 5 days after birth, she was at 2,101. Her resting heart rate was 63 pre-pregnancy, only got up to 69 during pregnancy, but 5 days after birth, it was 76. We do not typically see a reversal of resting heart rate. And typically, what we see is that it keeps going back. It goes back down to what it was pre pregnancy. And that happens pretty quickly. So when we see it go up, that's the automatic red flag for us. The other thing to note, though, is that her max heart rate was 140 pre pregnancy. That was with her exercising and everything she was doing day to day. 1 week before birth, it was only 126. Makes sense because her steps were a little lower. But 5 days after birth, her heart rate was 146. And that was max heart rate, meaning that over the course of the day, her heart rate got up to 146. It shouldn't if you're resting after delivery like you're supposed to. And so, the last thing that we saw was her stress, and she ended up reaching out to her provider, going into the med stop. They did an EKG. They noticed that her heart rhythm was off, and then that's when they caught her fluid overload. But her stress was 26 pre-pregnancy, only got up to 28 her entire pregnancy. That was her average. So for it to be 62 on our end was an absolute red flag. And so that's how we were able to catch her fluid overload before it turned into heart failure. And that's how we can use the numbers to change the statistics around pregnancy and post-delivery recovery as well. So Rachel, I'm going to turn it over to you.
If I
Thank you
can,
so
Dr.
much.
Sylvester, first, thank you for this data, data, data. No before, no no after. But two quick questions. Will that presentation be provided to our guests here today?
Oh, if they would like it, sure.
And then the other thing is that what I found was very helpful or insightful because I have the same app. I just right. So I was taking my notes, but what I found helpful and insightful is I see my data, but I don't often know what it means. And so you had some great notes with regard to sleep and how we should look at it and the like. And so the other piece is that if there's any notes that can be shared when you look at your sleep, the first half is this, the second half is that. It would be great for our audience as well.
Yes,
And
sir. I
then,
provided it as as a giveaway. We have
yes,
the whole MISS method in one document,
oh,
so people can
fantastic.
go through and check it regardless of what type of device they're using.
Thank you. Thank you
Yes,
so
sir.
much. Uh, Rachell Dumas, you are up next, and the
Thank
floor is
you
yours.
so much. Hi, everyone. It is a pleasure and an honor to be here. I am going to be showing another innovation that's going to help our not only maternal health community, but anybody that steps into a healthcare system, hospital, clinic. Just some backstory regarding the innovation that I created. I had 9 pregnancy losses over a course of 4 years, and I finally had my baby, who is now a potbelly 3-year-old toddler. His name is Nazaire. He's a healthy baby boy. But finally, after I gave birth, I thought that my medical trauma had subsided and that I could go on and be a mom finally and enjoy my baby. However, 6 months after giving birth, I woke up with acute vision loss. I had zero vision. I woke up, it was completely dark, and I had stroke symptoms, weakness, slurred speech, and I went to the emergency room. Just for context, I am a registered nurse with a neuro ICU background at a comprehensive stroke center. So I've been trained in neurology, deeply trained, and seen the worst of the worst cases. So I went to the emergency room and I told the doctor what's going on, and I was told that it was a stomach bug and to take Pepto-Bismol, and he discharged me, refusing to do a CT scan, which is standard of care for stroke symptoms. I literally had to go to a different ER. They immediately did a CT scan and took care of me. But it took 6 months for me to be diagnosed with a rare brain disease called idiopathic intracranial hypertension. And that quote unquote stomach bug led to 2 brain surgeries about 8 months ago. So, because I was able to speak the medical jargon and advocate for myself, because I had that background in neuro ICU and was able to call my counterparts, neurologists that I knew, neurosurgeons that I knew to help me advocate for myself, and because I was already in the research mindset because I was completing my master's degree, I was able to pull up the research to find that a GLP-1 actually decreases pressure in your brain. I found a 20-year study showing that it worked for the specific neurological condition that I have. And because of that, I was able to avoid an open brain surgery and also just save my life. So, because of that, I realized that so many patients are not able to advocate for themselves because they don't have the same resources. So, I put all of those resources plus more in the app. And I'm going to share it with you. This app is called HERD. It stands for Human Enabled AI Reporting and Documentation. And I'm so excited to show what's coming down the pipeline to make sure you're more confident in your advocacy skills when going into the hospital. So this is HERD. We're going to just log in here. I'm going to go off screen just for some bandwidth. Alrighty. Let's reload again. I'm so sorry. I have all my bars. I'm not sure why it's let's start over. Okay, here we go. So this is to her. When you first come on, it'll just tell you just a brief overview of what the app has to offer. It helps you advocate for yourself, document healthcare incidents in real time, notify your family and your healthcare providers of when you're going to the hospital or clinic or leaving there. There's an in-hospital tracker that I'm excited to show you about. You can also learn your rights as a patient and also get human help in form of legal help as well as healthcare advocates when needed. HER does not diagnose. We're here to assist and give recommendations. I'm going to put in my name here. We put in demographic information, and we can even upload a photo of ourselves. And let's get started with HERD. So it gives you a brief tour, but we're going to do that right now. So say you're in the hospital and your pain is being ignored. Let's go to pregnancy and maternal care because we have very specialized needs. You could set a hospital you're at. You can even send your OBGYN a quick update. There is a big gap where sometimes we as patients go into the hospitals and our OBGYNs don't know. This makes it very easy to notify them. There's an AI assistant that's specifically tailored to maternal health patients because of our specialized needs and guidance. So you can go and click one of the above prompts, like maybe you're being dismissed, or you need to get a second opinion, or you're questioning like different rights that you have. But you can put something in like, I'm in the emergency room with bleeding. I'm 34 weeks pregnant, and no one is listening. Not only is it very empathetic, and during my pregnancy journey of 9 losses, it was a lot of times that I encountered providers who were very dismissive. There was even a provider I had to show her a picture of my baby that fell in the toilet just to receive care. And so when you're coming from situations like that and you're trying to get help from an outside source while encountering those situations, I want to make sure that if you're using the app that you are heard. That's why I named it Heard, but also that you're believed and validated in your experience. It tells you exactly who to talk to, either the nurse or a doctor, and it tells you exactly what to say. As a healthcare provider, we are trained to pick up on certain keywords and buzzwords from our patients that makes us pay attention or give attention very differently. So, like for instance, it's saying, "This is what you tell the nurse or a doctor that I'm 34 weeks pregnant, experiencing active bleeding. I'm concerned about placental abruption or preterm labor. I need a physical assessment or fetal monitor started immediately." It gives you those keywords and also how to talk to them and who to talk to. It's also going to ask you, so where are you now? What are you doing now? What's the current process? So we can continue to give you updated recommendations. We're working with certain organizations like the National Perinatal Task Force. We are the first perinatal safe spot. And we're making sure that you have all of the resources possible to make sure you have good care. And that is one of them. Also, you're also able to escalate in real time. So I'm going to go out of here. Um, if you click escalate, you can file a complaint, but we always make sure we say follow the chain of command. We don't want a simple misunderstanding to be escalated to like the Department of Health or Joint Commission. So we make sure we're coaching patients on who to talk to when, and if it does get to that point, this is how you escalate. So it has all the reporting agencies. It tells you when to report, how to file, what's their number, how long it takes for the review. So it has that information. And more importantly, there's what's called an API. So whatever hospital you're in, we're pulling that information to already have their advocacy information, like emails and ombudsman's information. So you don't have to research in the middle of a crisis or a healthcare issue, this contact information. So you click on who you want to email, that case that we started earlier, and other information that's in the app could be pulled into this email, but specifically that case, you go ahead and click it and you use that, and it will create an email in seconds. So it'll have whoever you're emailing, I'm writing this formal concern on this date, this happened. This is what the nurse or the doctor said, or whatever healthcare provider, and this is what I'm requesting. As you can see, there's a timer. So it literally does it in literally seconds, and you don't have to look up all this information. And a lot of times, we don't know how to find this information. And the last thing I wanted to do in the midst of my medical trauma was to do research, which unfortunately I was forced to do often. There's also human advocates. There's a healthcare advocate that you can talk to as well as a legal one. We also do medical documentation review, and we're partnering with organizations such as American Cancer Society. So there are free resources within the app that you can take advantage of that's tailored to your needs. You can find care near you. Like I said, we're partnering with these organizations to make sure they're on the map too. So you have just not only healthcare facilities like hospitals and clinics, but different resources like Healthy Mothers, Healthy Babies in Georgia is an amazing resource that helps moms with health education and prenatal care coordination. Because we know social determinants of health are a major need. So I want to go to an actual hospital, Grady Hospital. I used to work here in the trauma center and the stroke center, actually. Grady Hospital. We want to pull in the ER times. That's very important. Also, if you're having a certain issue, while you may be closer to one healthcare facility, another may be actually better, right? So if you're at some other facility, but you're having stroke symptoms, Grady may be a better one because they specialize in stroke care, right? And they're top 5% nationally. So you can navigate there, click whatever navigation app you want to use. There's actually indoor navigation. I'm not sure about you guys, but in the midst of all my hospitalizations, I would just forget where the car is. So you can literally park your car like on the app and say, I'm right here, so you know where you are. But also you can find different places in the app. Like if you're trying to get to a second floor, third floor, or the cafeteria, you can use the app to find these places. So if you go to the hospital, go to Grady, go to indoor, you can say, oh, I'm looking for the cafeteria, I'm hungry. It'll give you a GPS, which will look way more dynamic because we're partnering with a company who also does like all your airport maps, which will make this much prettier. But the gist is that it'll show you how to get from point A to point B. Additionally, my favorite feature and our beta users' favorite feature is the caregiver mode. If you toggle that on, you can literally see where your family members are, as long as they've given you permission, because we are HIPAA compliant. So say mom, she's at home, no worries. However, dad is in the hospital. All right. And even what's even more dynamic is that we have a doula setting. There's a big gap in care where doulas can't show up to every appointment and be at every hospital visit for their patients, especially in the climate where doulas are still considered guests in a lot of hospitals. This is very, very important. They can literally see how many active patients they have, who's high risk, who's at the hospital, right? How many weeks they are, their vital signs. They can see their birth plans. You can update your birth plan as a patient. And more importantly, they can track the movement. So Tanya went to the hospital at 10:15, then triage at 10:20, got labs at 10:35, and went to labor and delivery at 11. You can literally monitor your patient on here. Don't we wish those times were that accurate and that quickly? But sometimes for labor, labor and delivery it is. But we can also notify healthcare providers. We can set this as an automatic notification. Like if you're in a certain range of a hospital for a certain period of time, it's understood that you're probably in the hospital. So it'll prompt you to say, hey, are you in the hospital? You say yes, and they'll notify your family and friends. One of the things when I was having brain surgeries last year is that it was very exhausting. One, I was waking up with vision loss every day, so I couldn't even see my phone, which is so important to have a caregiver mode. But two, also it's exhausting to update all of your friends, all of your family, your coworkers, everybody. This makes it very easy. Another thing is the AI insights from your Aura rings, your Apple Watches, your blood pressure cuffs. AI is able to analyze that data and say, hey, you have an upcoming appointment with a cardiologist. This is a good time to talk about that blood pressure elevation that you've experienced. Or, hey, we've noticed that you've reported recurring headaches. This is a good time. Maybe you should see a neurologist. We've already vetted this one, things like that. There's resource hubs and recommendations. You can look up different clinicians based on what patients have said, or ones that Common Sense Childbirth has updated based on their vetting systems, which is a trusted one. There's a resource hub, so you can look at information about navigating insurance denials, or look at patient advocacy directories, things like that. It's also gamified, so the more you're looking at articles, learning about how to advocate, joining communities, our herd community, looking at live workshops, you get more points that you can use for the chats and the advocacy consultations and the legal consultations as well. So the whole app is built literally to help you navigate the healthcare system as a clinician, as a caregiver, as literally a patient. And I would love for you all to become beta users. I just put the link in there as well. And I would love your feedback. Thank you so much.
Beta users are essential to and growth of any sort of aid solution or technology. So welcome you all in that. The app is incredible, Rachell. I can't tell you the number of times. So as a father of two, where do we go? Those types of things. But just having all of that information, especially for the caregivers, whether it's in-laws, me as a husband, any of the caregivers that we're having, it's just super impactful. So thank you for that. As a reminder, everyone, please submit your questions. For those who already have, we'll dive into our question and answer period. So first one's for Dr. Sylvester. Dr. Kat, your own experience with postpartum preeclampsia was caught because your midwife knew your norms, even when your blood pressure was technically in a normal range. How does Operation Mist help mothers establish and communicate these personal baselines to providers who might otherwise rely on generalized protocols?
Yeah, that's such a great question. It's as simple as what you just said. We help people know their baselines.
Mm.
When we were initially using an app, we actually have two apps that we use now. The
Okay.
first one was for general health, general populations. They were trying to see what are the trends in different populations of people. And what was missing was that individualization. So the question is, if my blood pressure is 100 over 60, when should I be concerned? And so what our app does is it actually calculates that for you. What is elevated for you? What is high? What
Mm.
is concerning? What is too low? Because sometimes people focus so much on high blood pressure, but we know that with other complications, blood pressure can get too low. And so we need to know that as well. So in waking up and taking it every day, and then us having the averages on our app, then we're able to reach out to people when they deviate from what's normal for them. So that's within our algorithm. It's an app that we have that's kind of provider facing. And so we're able to see if someone's resting heart rate is out of range, their sleep quality, their sleep the sleep hours, their steps, like if anything changes, because sometimes, the steps, they've actually helped us detect postpartum depression. Someone has gone from every day taking 8,000 steps to now they're at 1,000 and they're not sick, nothing's going on. And so there are things within the data that help us pick up on things that people would otherwise not communicate as well. So, yeah, knowing their baseline is why we do what we do. If people stop using standards and protocols, I believe that if people were just compared to themselves, which is like the best research ever, right? It's like, how were you 10 years ago and what are you doing today? If we just did that day to day in healthcare, we would be better off. So that is why the MommyMonitor exists.
Thank you. The next one's for Rachell, but Rachell, you also got a great shout out in the chat. You should definitely look at that. But question, many people fear AI will make healthcare feel less human. However, Hugh Herd uses human-enabled AI. How does your
Hmm.
platform use technology to actually restore the human element, the patient's voice to the clinical encounter?
Yeah, it's human back, so it's not like ChatGPT. And no shade to ChatGPT. I love Auntie Chat myself, and Claudicia, as we call them over here. They are great assets, right? But they're just that, they're assets. AI in a healthcare setting is meant to be used um, as a companion, opposed to it being taken over the healthcare experience. We still need that human interaction, and some people feel like it'll progress enough that we can remove us. And I know in some situations, there has been limited human interactions, but as far as nursing, healthcare, diagnosis, we still need that human interaction. There are a lot of limitations for AI. um, a lot of AI, especially if you put your health information into ChatGPT right now, it can only give you information based on exactly what you put in. It's not going to dive deep into the background. It's not going to say, "Hey, but do you have a history of hypertension? Were you at the hospital last week and you they diagnosed you with preeclampsia? You were just pregnant." It's not going to deep dive into those things. So we need that human experience. So that's why I was very adamant about keeping it there, having those healthcare advocates within the app that's attainable, are able to talk to our patients as well. Because the other thing that I do know, not as a clinician, but as a patient with lived experience, is that I don't want to talk to an electronic when I'm really in the midst of a crisis. I do not want to talk to AI. I need my answers from a neurologist when I'm trying to consider if I should do an open brain surgery or stent or whatever the case may be. I need to know what is your professional experience with this. The stats are great, but it's not tailored to my unique needs. And that's the limitations of AI. And one of the things that I also noticed is that hospitals and healthcare systems are using AI very freely now, whereas before it was kind of hesitancy, but now it's part of dictation, and other different, and documentation and other different ways. But patients are not using it correctly. We're using ChatGPT and it has all these limitations. And I want to create a safe AI platform where it can guide you in the right directions. You saw how my AI asks further questions and probe and things like that. That's because it's human backed. And I want us to have that same, like an equal platform as the hospital. So yeah, you're using your AI to help out. I'm also using my AI to help out too. And we're going to create this dynamic care plan that's individualized for me. And we're going to give me the help I need quicker, more efficient. And it's going to be something that I'm comfortable with as well. So,
Love that. Definitely love that. So keep the great questions coming. On to our next question. You've spoken of, I think this is for Dr. Kat. You've spoken about, but feel free, Rachell. You've spoken about how assumptions regarding race, age, and geography fuel the maternal health crisis. In what ways does providing a mother with her own data act as a shield against these biases?
It was a shield against the biases against me. So I told you about my midwife story. That's what I focus on the most. After I delivered my baby, my midwife had to turn my care over to an OBGYN who had never seen me before. He had all my records, access to all of my information. But he told me over the course of a couple of sessions, you're black, you live most of your life in the South, you probably had high blood pressure before you got pregnant. Your kidneys are never going to heal. You're going to be on high blood pressure medication for the rest of your life. And on the off chance that I am wrong, your body is not fit for having another child. So those were the assumptions that he made about me. And when that happened, I was like, he's on my team, but I didn't choose him to be on my team, right? And if I could have, and if I had known before I delivered that he would be the supervising OB, then I would have made a different choice. And so it was at that time that I decided I know who needs to be on my team. I need a kidney doctor, a cardiologist, a physical therapist. I need someone watching my data with me because I do have the watch, but I'm also a mom of two. I got a pharmacist because I didn't want to be on blood pressure medication forever, and had people praying for me all over the world. And that is why these results happened. Data completely changes your resolve. You see what's working, you see what's not working, and you see the next step that you need to take to make better decisions. And so we have seen moms. You talk about the monitoring is one-on-one. So every mom is given a monitor who is also a healthcare provider. And then there's another person who's also watching all of the data. And what we see is that when women have the numbers, when people have the numbers in front of them, they make better decisions. They move closer to their providers if the travel is stressful. They ask to work remotely if their blood pressure is too high. They stop going to their favorite restaurants. They stop eating ramen noodles. They ask their family members to help them cook so they have better food. We make different decisions when we see. But the other part about advocacy that I have seen, because it's happened over the years with that one mom who went in, they took her symptoms seriously, they investigated her heart problem, they got her on the right medications, got her to a cardiologist. There are a lot of providers out there like that. But what we've also seen is one mom go through 11 providers in 4 days, and they were the ones that caught her heart failure. They kept ignoring her symptoms because she didn't look that bad. Even though she had chest pressure, her heart rate was dropping into the 30s, her blood pressure was in the 190. I mean, it was like, how much more clear could it be that something is wrong with this person? But because she had the data, her and her partner would not stop until they found a provider who would listen. And as soon as they did, they checked her BNP, this lab value, saw that it was over 2,000, and that she was in heart failure, and they gave her the medication that she needed, got it back under control, and now we're working to get her off of her blood pressure medication. That's what data does. When you know yourself, you wake up every day and you know what you look like, nobody can tell you that your symptoms are not significant. You just now decide, I'm going to find the person who will take me seriously.
That is very powerful. And the other thing that I would say is that you all have taken technology that we use every day in some way anyway. The steps, everybody's counting steps, and right. So you're just, hey, use it this way. Here's how you might track it during this period of time. Rachell, you bring together so much great information, but handheld, easily accessible. We do it for any other part of our life. Why not for this most important moment? So that's very just telling, impactful, inspiring, and you're bringing it to us in such an easy way to consume.
I
Right.
appreciate it so much. And outside of pregnancy, I just want to give one example. I had a friend, I've been monitoring his data forever. And because when we started first monitoring, it was back in 2014, but it was with a different device. And he went to his doctor, and his doctor said, your blood pressure's up. We may have to start thinking medication. Now, he sees his doctor twice a year, right? So he told her, he said, look, this is what my last week has looked like. And traditionally, if I've eaten this way, I don't get, at least for him, it's 20,000 steps a day. If I don't drink a gallon and a half of water a day, then this is what my blood pressure looks like. And that's what we've done. We just had a vacation. And so he talked to his writer, showed them the records. So what we do is we print it off for them like PDF forms so they can take it in, show their provider. So it's not what you're seeing of me today. This is my life. This is what I do day to day. So yes, it's high today, but it's not always high. And he was like, so when I come back in 6 months, it'll look different because I don't want you making a decision for my long-term health based off of what you see of me today. when I know what works and I just haven't been making the right decisions. So it's really empowering regardless of where you are, right? Because for our community, they say we're at a higher risk of stroke, high blood pressure, heart disease, kidney disease, heart failure, heart attack. Everything that could happen is happening to us, but it doesn't have to. We can wake up every day and say, I'm walking in the opposite direction of that outcome. Yeah.
Love that. Love that. So, next question, Rachell. Many postpartum complications happen after a mother has been discharged while she is navigating recovery at home. Since the Herd app provides escalation templates and scripts, could you walk us through how a mother might use these in an outpatient setting, perhaps during a follow-up phone call or a clinical visit, if she feels her concerns about warning signs are being brushed off as normal recovery?
Absolutely. So as you saw with the AI chat feature, you're literally able to go in and put that information in. I'm talking to this provider. It already has your health information saved in there, so it's taking that into context, opposed to like another AI system like ChatGPT won't always do that. So it'll guide you to say, hey, you still need to notify the OBGYN of this, but also ask for a referral for cardiologist, ask for this doctor. It may be time for you to do a sooner follow up with this doctor. Actually, you need to go to the emergency room right now. It detects those emergencies. It picks up on those, even the nuances where you might say, "Hey, I'm feeling a little weird. This is what's going on." It helps you navigate how to put those symptoms into words that you can describe to your healthcare provider, because we know that's a really big issue, right? It's so many times on my pregnancy journey where I just felt weird. I can't explain what was wrong with me, but I felt weird. The emergency room cannot do anything with that information. But at the same time, I felt weird. I went there and I'm saying, and I'm trying to um, quantify this information and be able to make it make sense for them so they can treat me. And the times that I couldn't, I had to go home, and then I would lose a baby. I lost 9 of them. So though that also matters too, like making healthcare information, which can be very complex for patients, especially data, as Dr. Kat talks about, into layman's terms and what that means for them. But also the other way around, we don't talk about this often, is that when we have a symptom, how can we make it so our doctors can understand what is going on with us when we just feel weird? So her app helps with that and helps direct which doctor you should talk to with symptoms about, how to bring in your interdisciplinary team. My own experience is waking up with vision loss and stroke symptoms. And it's so hard to see a OBGYN, maternal fetal medicine, reproductive endocrinologist, and this whole OB healthcare team for 4 years, almost on a weekly basis. Pray for me because I still am paying bills. But anyways, it's hard to go from that to now you need a neurologist, a neurosurgeon, a neuro-ophthalmologist. It's hard to make that transition where you're so used to every little thing. I'm gonna go to the OB. Not even primary care. You typically just go to the OB. They become your general provider as well at some point. So that transition is so crucial for patients in postpartum because one, we don't know how pregnancy will impact us. A lot of times, there are patients who have chronic issues, hypertension, diabetes, all these things, and then go into pregnancy. Those issues don't just magically go away. They could get worse after pregnancy and postpartum period. We have to be able to be reminded, hey, yeah, you've given birth. We have to go back on our schedule. All of these things are so important, and it truly helps when you have technology that works in your favor and reminds you of these things, and to help guide your healthcare experience.
Thank you for sharing. Sorry for your loss, but the inspiration and your courage to be able to create this is clear, right? Your why and
Thank you
how
so
it can
much.
help all of us. So thank you.
Thank you.
Just as a reminder, we will be wrapping up in about 7 minutes, but I want to get in as many questions as we can.
That happened so
Um,
fast. Goodness.
Time flies when you're delivering opportunity, right? When you're delivering care. For a mom to be who might feel overwhelmed by numbers, How does your team help her translate data from a wearable device into specific conversations or action with her OBGYN or midwife, Dr. Cat?
So the moms, we don't have that experience with moms being overwhelmed because they also have a healthcare provider to help them interpret. So, with our initial talk with moms, we see if it's a good fit for them, right? Not everybody will do well wearing a watch. Some people are allergic to watches. Some people get anxious if they're alerted that something is going on. And so, we talk to moms typically the first time for an hour and a half, and we get to know where they are in their journey. But to be honest with you, most moms who come to us, they've had a previous complication that they thought could have been avoided. They had a cesarean that they didn't expect. They had a miscarriage, or they felt like they were unseen or unheard in some way. And so the big thing about Operation Miss is that no mom walks away feeling unheard. They are seen, they are loved, they are valued, and they know it. And so sometimes people even say, how do people feel about being monitored? They don't feel like they're being monitored. They feel like it's a sisterhood. They have a sister who happens to be a healthcare provider who also happens to see her data. So when we reach out, we don't say, "Oh, your stress was 62 today." We don't do that. We say, "Hey, it looks like your stress is a little elevated. Did anything happen last night that you can think about?" And they might say, "Yeah, I got into an argument with my partner, and that was on my mind when I went to sleep." So that gives them information. So then they're able to make sense of the data. So it's not that we're talking to them about data, it's that we're using data to drive our outreach. And so when we outreach, they see a pattern. Every time I eat within 2 hours of going to sleep, I have high stress overnight. My sleep quality is low. Every time I drink alcohol, for our moms who are not pregnant, it takes 4 days for my body to recover. One part that I like about the watch that we use is that it has a body battery. That is, I mean, it's just genius. It's like a phone battery. So if you wake up and your body battery is 100, it actually pulls all the data together, like resting heart rate, movement, and sleep, I believe, and then it gives you that number. And so if it's 100, just like if your phone battery is 100, you know your body is primed to do whatever you want to do today, right? But if you wake up and it's 5, then that means that your body is like a 5% on your phone. You probably shouldn't be doing anything that's not necessary today. And so I think that because it is data paired with a person, that people are simply not overwhelmed. And when you look, like if you go to our Google review page, people don't talk about data. They talk about how they felt loved, they felt seen. Someone saw something in their data that helped them avoid a very bad complication. MommyMonitor saved my life. It's like they're not worried about the data. We worry about the data, so they don't have to. What they worry about, though, is what we talked about: sleeping 7 to 9 hours of sleep at night when they can, drinking half their body weight in ounces as they grow, right? We grow during pregnancy. So it might be that we needed 60 ounces initially, but now we need a lot more than that. And so what they're focused on are the lifestyle decisions that end up with good blood pressure, low stress, good rest, and just good numbers overall. But they're not overwhelmed by the data because we don't mean for it to be an overwhelming experience.
Thank you for that. So I want to be mindful of time. We appreciate everybody's attendance. But first, Dr. Kat, Rachell, thank you so much for what you're giving to the community, what you're providing, taking your lived experiences, your thoughts, and how this can all be better for all of us, um, and bringing it to the market. So we're so very grateful for that, for your time and talking through this. Everyone else in attendance, thank you for making this such an impactful week. We know some of you came back for this one, some of you it's the first time, but we can't do this without you all. It is important, it is impactful, it is educational, it helps us to be advocates overall. And so there's information in the chat for you to be able to connect with Dr. Kat and Rachell. There's also information regarding Birthing the Magic Collaborative to continue to support what we do at Birthing the Magic Collaborative. Thank you all today. Hope you have a great weekend and hope that this makes your life and your journey better.
Thank y'all for having us.
Everybody, take care.